Hello, I'm Dr. Jennifer Zomner, and I am here to talk to you a little bit about the coronavirus. We've heard a lot about this in the news recently, and I wanted to kind of give you a summary of what is a coronavirus, what does it mean, and what can you do to prevent it. So viruses are a little bit different than bacteria. You've all heard of different bacterial infections, and you can go and take an antibiotic, and that can help. There are viral infections that are not like bacterial infections. Viral infections replicate a little bit differently, and viral infections generally are more difficult to treat than bacterial infections. Fortunately, your body has evolved over time to fight viral infections pretty efficiently. When you get a viral infection, you will have a runny nose, and that mucus has a lot of immunoglobulins that help fight that virus. So the fever that you get with a virus tends to break down the proteins in the virus and help your body fight it off. And your body also has an immune system that builds antibodies to certain viruses so that you can't get that virus again, or if you do, it's not as bad of an infection as the initial infection was. The coronaviruses are a large group of viruses. There are many different coronaviruses. They look like a crown under a microscope. That's why they're called coronavirus. There are 7 different coronaviruses that infect humans. There are 4 common coronaviruses that commonly give humans what we call the common cold. And so most of the time, a person will get a coronavirus of some kind of the 4 common types, and it'll give you a cold, runny nose, sneezing, fever, body aches, and you will fight it off and be just fine. Occasionally, a coronavirus will be a novel coronavirus. And any virus can be a novel virus. All viruses were new at one point. When a human is exposed to a novel virus, they don't naturally have an immunity to it like they do the regular viruses that they're exposed to, every cold and flu season. So one example of a novel coronavirus was the SARS virus. That began in 2002 in China. And then after that, there was the MERS virus, MERS, that started in the Middle East. And we know a lot about the MERS virus, and the incubation period for that virus was between 2 and 14 days. And the CDC is believing that the incubation period for the new 2019 novel coronavirus will be between 2 and 14 days based on the behavior of the MERS virus from 2012. The way that a human catches a virus is generally through your nose, your mouth, and sometimes your eyes. Viruses love mucous membranes. You will breathe them into your nose, breathe them into your mouth, or touch your eyes. The virus gets into your body starts to form a response to it with a runny nose, fever, etc. And so one of the main ways to avoid getting a virus is to wash your hands frequently for at least 20 seconds. Try not to touch your eyes, your nose, your mouth, especially if your hands are dirty. You want to try to avoid being in close contact with people who have symptoms of a viral infection, such as fever, runny nose, cough. So, and if you are sick, you want to try to stay away from public places. You want to, if you are going to go to the doctor or the hospital and you are coughing or having a runny nose, basically any way that you could have excretions out of your body, you want to wear a mask so that you're not passing that to other people. So again, it's important to wash your hands and try not to touch your eyes, your nose, or your mouth. If you are sick, try to stay out of public places. Stay home, rest, drink plenty of fluids. If you are having major symptoms, high fever, any shortness of breath, respiratory distress, anything like that, you need to go to the emergency room.